about various steps which are involved in the adrenergic activity. So let us go ahead. We'll go for what are various adrenergic agonists which are present. Just like earlier we have seen, if you remember about acetylcholine, we have got agents which are having direct or indirect activity. Now, yesterday, whatsoever figure we have seen, you just remember it or you should keep it with you ready, because that figure plays important role in understanding how the various agents on adrenergic system they are acting. So we have various agents. Example of these are directly acting and indirectly acting. These are two important classes, and one more is there, that is mixed acting. So let us see how they are doing. First one are directly acting, selective, non-selective. Selective means specifically acting on either alpha 1, alpha 2, beta 1, beta 2, like that. So example of these are alpha 1 phenylephrine, alpha 2 clonidine is selective. See, whenever we use the word selective, it doesn't mean that it will act exactly on alpha or alpha 1, that means phenylephrine, or alpha 2 exactly on clonidine. They do have some acting on other receptors also. That is, the example clonidine may act on alpha 1 also, but the proportion of acting on alpha 2 is much more than we call it as a selective. But theoretically, no, uh, exactly, there is no such selective. We call it as theoretically, it is highly selective. But that means that if it is having 90% action on alpha 2, there may be 10% action on alpha 1. Okay, that has to be kept in mind, and otherwise it will cause confusion. So when we say selective, that means only proportionally, proportion wise, it has got maximum action on that particular receptor. So therefore, we call it as a selective one. Got it? This particularly when will we go for therapeutics, or whenever we'll go for more detailed discussion, at that time this thing you will come across, then you should not get confused, sir. We have seen it as a selective, now it is acting also on some other receptor also. So that can happen, but the proportion is, as I told you, proportion is very important. So proportionally very high amount of percent is there, which is acting only on one type of receptor, therefore we call them as a selective. So these are selective. Example is alpha 1 phenylephrine is selectively acting only on alpha 1. That means it has got major activity. Most of the activity, proportionally highest activity, will be alpha 1. Maybe slight activity on alpha 2 or other receptor, but very high activity on alpha 1. Similarly, alpha 2 clonidine, beta 1 dopamine, beta 2 terbutaline, and there are many like on beta 2. I told you about there are many drugs which are acting on beta 2 selectively in respiratory, beta 2 in respiratory tract, beta 2 in uterine muscles. So there are many beta 2 which shall be studying later, particularly, or many agents in each selective class we shall be studying. Non-selective, there are agents which are acting on, example, alpha 1, alpha 2, both are there. Example is oxymetazoline. Then there is a drug which are acting on beta 1 as well as beta 2. Example of this is isoproterenol. Drugs are acting on all alpha 1, alpha 2, beta 1, beta 2 is epinephrine, which is natural. Comparatively, having more activity on alpha 1, alpha 2, and beta 1, and very little beta 2 is norepinephrine. So these are various agents. These are the responses. They are not reduced by the prior treatment with reserpine or guanethidine. Okay, these are not reduced by prior treatment with reserpine. Guanethidine means because they are selectively acting, and therefore response may be potentiated by cocaine, reserpine, and guanethidine. Why responses are potentiated because of this? Because cocaine is indirectly acting, reserpine is causing what it is causing? Reserpine is causing the inhibition of transport inside the vesicle. We call it as a vesicular transport. So it blocks the vesicular transport. If it blocks vesicular transport, what happens? Because of that, free drug is available. That free drug is able to cross easily through pores. Okay. So in that cases, the response is potentiated by cocaine because cocaine also compete for the pore, and therefore through same pore cocaine will also be coming, and because of that what will happen is cocaine, reserpine, these will cause increase in the concentration in the synapse. Okay, so therefore these responses are not reduced by prior treatment with reserpine, these drugs. Then there are mixed acting agents. Example is ephedrine. It is having both direct as well as indirectly acting. So how it is doing? Ephedrine is drug, it can act on alpha 1, alpha 2, beta 1, beta 2, and it is also acting as a releasing agent. Okay, so its response is reduced by prior treatment with reserpine or gonethidine. Why it is there? Because less drug is available because of reserpine. And gonethidine is what? It is a uptake one. We have seen that some of the adrenaline come back into the presynaptic neurons, so that is guanethidine. That is through uptake one mechanism. So these are the agents which can impact, which can make the impact on uh, the that is reserpine administration can be there, that is with the ephedrine. Then indirectly acting, the agents which are releasing, which causes release of noradrenaline. Example of this is called as are amphetamine, tyramine. Tyramine is present in cheese. So these responses are abolished by the prior treatment with reserpine or guanethidine. If guanethidine is given or reserpine is given before that, then amphetamine or tyramine effect will not be seen. Okay, we shall discuss this because it is very important. This whenever tyramine and this they are called as a cheese reaction. Okay, you can search in what we call it as a cheese, because tyramine is a component which is present in cheese. Okay, and therefore somebody, if somebody eats cheese, then and reserpine is there, then it can cause very profound action. We shall see it later. We are just comparing now. Then next are the uptake inhibitors. Example of it is a cocaine. I have told you there is a uptake is going on. So there are uptake inhibitors like guanethidine, cocaine. They are the uptake inhibitors. Then there are drugs like mono amino oxidase inhibitor. We have seen its impact with reserpine in yesterday's class. That if MAO inhibitors are given along with reserpine, then it will change, because reserpine is blocking the vesicular transport. Because of that, free drug is available outside, which is susceptible for metabolism by monoamino oxidase inhibition, monoamino oxidase enzymes. And if we inhibit this monoamino oxidases, then we can see a profound adrenergic reaction. So these are the agents which are called as a MAO inhibitors. They are very much in therapeutics. There are at many places they are used. In hypertension, they are classified. They are present in various CNS diseases like Parkinsonism. So they are part of the treatment. Then lastly, COMT inhibitor. We have seen that COMT is present in the synapse or nearby tissues in the synapse. That is catechol O methyl transferase, and this is the enzyme which is causing inhibition of, which is causing metabolism of adrenaline or noradrenaline. So adrenaline, noradrenaline, which are there, which are available, they will be metabolized. So any inhibitor of this COMT, that will cause increase in the concentration of adrenaline and noradrenaline in the synapse, and because of that increase in the concentration in the synapse, the activity will be more, activity will be long lasting. So this is what how we can classify. Very important thing, whatsoever kind of drug is there, we know now. What we have to understand is what we know: the receptor, we know what are the action of this. So what will be the pharmacology of the agents which are acting on this receptor? Okay, the next thing is we have to make it, or we have to make the relevance with that, how we can relevant. Now let us see, let us discuss, let us understand what you understand. uh, Suppose there is a directly acting agent, selective agent is there, which is suppose alpha 1 phenylephrine. So what will be the effects we can see from phenylephrine? If phenylephrine is administered, what effect you feel that you will able to see? Anybody? What will be effect of phenylephrine if phenylephrine is administered? No answers? Okay, yesterday we have seen various effects. Can you revise this? Can you tell me which are the effect which are alpha 1 mediated, alpha 2 mediated? Can anybody say? What are beta 1, beta 2, where these receptors are present and what are the actions are expected? Yesterday we have seen the table. That means you have not studied. Yesterday I told you that these are the tables which are important. Please go through this table. You can use any book, whatsoever book you have, anywhere you can get it. What are the alpha mediated effects? What are beta mediated effects? Yesterday we have seen that. Okay, very good, Dheeraj. So what effect you will able to see? What will be the pharmacological effects of phenylephrine? What is tachycardia? Why there will be tachycardia? Which receptors are present in heart? Which receptors are present in heart? See, Ajit, I have not taught you anything about phenoxybenzamine. If you are searching somewhere simultaneously on internet, so I want to see how you learn. Okay. Phenoxybenzamine I have not discussed now. We are not discussing anything about antagonism. What we are discussing is which kind of receptors are present on heart. Alpha 1, alpha 2, beta 1, beta 2. What are there? Beta 1. Now phenylephrine acts on which receptors? Phenylephrine acts on which receptors? What is its action on beta receptor? What action phenylephrine shows on beta receptor? Why there should be increase in heart rate, Anirudh? Okay, it acts on beta receptor, beta 1, it causes increase in heart rate. Does it act on beta 1 receptor? What we have classified it as a, what we have classified? Selective. On what receptor? It acts as a selective agonist on alpha 1 receptor. That means what is its action on beta receptor? No action. If it has got no action on beta receptor, then will you get any action increase in heart rate? So, very simple pharmacology is. It is not a very this one. When we say that phenylephrine is acting on alpha 1 receptor, that means you have to just recall from your memory where alpha 1 receptor is. So you know that alpha 1 receptor is there only in blood vessels, and whenever alpha 1 receptor is stimulated, it causes vasoconstriction. So it causes vasoconstriction, that means it causes increase in the blood pressure. So very simple. Alpha. Now you understood the pharmacology of phenylephrine. That phenylephrine can act on alpha 1 receptor. You understood this much? Now let me tell you more funny thing. Okay? This is so far simple. Now what phenylephrine is doing, I told you what it is doing, what it will do, phenylephrine. Again, Anirudh, you are making same mistake. It is not increasing heart rate because there is no receptor, no alpha 1 receptor in heart. So it is acting only on blood vessels. And because it is acting only on blood vessel, it is causing increase in blood pressure. It's clear? Don't get confused. Clear? Now, you have studied something about reflex mechanisms in cardiovascular system. You have studied something about baroreceptor, chemoreceptor. Have you studied? What is role of baroreceptors? And what will happen because of that? What impact these baroreceptors can cause? And because of detection in change in BP, what they will do? Why they will increase blood pressure? Baroreceptors will. they will send the input. Simple thing is they will send the input whether the blood pressure has increased or decreased. Okay, if blood pressure is if blood pressure is decreased, what they will do? If blood pressure is less than normal, what they will do? And they will send output or they will send input to. And if there is a vasoconstriction, what they will do? Okay, you take this as a homework, you study on this. Okay, what is the role of baroreceptor? Then you will understand many other things which are there. We call them as a reflexly or paradoxically. Reflexly means because of this reflex mechanism. Now I'll just tell you, for better understanding you have to read the things about the reflexes well. Okay, I am deliberately going slow, I am giving you time. If you do not read, then it will be your loss. Now suppose I have administered phenylephrine. What will happen because of phenylephrine? What will happen because of phenylephrine? What will be the effect of phenylephrine? I want to understand. Yes. And what will be its effect? And what will be its effect on heart rate? Why it will increase, Anirudh? Sava Samiksha, why it will increase? This was how much time I have told you? Third or fourth time. There is no beta 1 receptor, so it is not stimulating beta 1. If it is not stimulating beta 1, it is not causing increase in heart rate. Now, if I say it can decrease heart rate, okay, it can decrease heart rate. Now again you will be in a this one. अभी तक तो तुमको लग रहा है हार्ट रेट बढ़ाएगा, but what it can do is if it has increased the blood pressure, baroreceptor will send the information to the hypothalamus cardiovascular center, and cardiovascular center can decrease the sympathetic firing. Because of decreasing the sympathetic firing, it will decrease the heart rate, and it can decrease the force of contraction, which is the sympathetic action. ये काय की वजह से हुआ? बैरो रिसेप्टर ने ब्लड प्रेशर इंक्रीज का सेंस किया. सो इट इज नॉट द डायरेक्ट एक्शन ऑफ phenylephrine, but reflexly, indirectly, it can cause decrease in heart rate and decrease in force of contraction. ये समझ में आया तुम्हारे? तो कौन कौन बोल रहा था इंक्रीज इन हार्ट रेट? आई रिपीट, मैं जानबूझ के स्लो जा रहा हूँ. आई एम टेलिंग, ये इससे भी फास्ट जा सकते हैं, मैं फटाफट तुमको बोल सकता हूँ. ये तुम्हारा बेसिक समझना चाहिए. मैं बार बार तुमको पहले भी बोला था कि ये पढ़ने से पहले एक बार अच्छे से पढ़ के ये कर लेना. तो कार्डियोवास्कुलर सिस्टम वापस से पढ़ लेना और ये भी पूरा पढ़ लेना. ठीक है, मुझे आई एम एक्सपेक्टिंग क्वेश्चंस फ्रॉम यू. अगर ऐसा होता है तो सर ऐसा क्यों हो रहा है? देर आर बीटा वन स्टिमुलेंट्स, बिकॉज ऑफ दैट they can cause reflex in the decrease in the blood pressure. तो ऐसा क्यों हो रहा है? तो we should understand the reflex mechanism also, कि what can be the chances, what can be the reason behind it. ठीक है, क्योंकि पहले हम सिंपल समझना है, उसके बाद हमारे पास कॉम्प्लेक्स समझने के लिए जाना है. पहले अपना सिंपल पे वी शुड बी वेरी क्लियर अबाउट इट. What is very simple is there are alpha 1, alpha 2, beta 2, beta 3. These are three receptors. These receptors, some of these receptors are present in all organs, some of the receptors are present only in specific organ. ये अपना basic है. Alpha 1 is present in predominantly in blood vessels. Beta 1 is predominantly present in heart. है ना, ये हमारी बेसिक अंडरस्टैंडिंग हुई. अब we know that there are some drugs. हमने in earlier class, in yesterday class, we have seen that there are some drugs which are specifically can act on either alpha 1, alpha 2, beta 1, beta 2 like that. We have seen the reasons. Okay. So this is another thing we should remember, that there are drugs which are selectively acting. Example, isoprenaline, which is synthetic, it doesn't act on alpha 1, or it has got minimal action on alpha 1, maximum action on beta 2, beta 1. Again, beta 1, beta 2 has got indirectly opposing effects on each other, because if beta 1 is stimulated, it causes increase in heart rate, it causes increase in force of contraction. If there is increase in heart rate and increase in force of contraction, what will happen to blood pressure? If there is increase in heart rate, see, beta 1 is stimulated, beta 1 is in heart. So drug, example isoprenaline, is causing increase, or is it stimulating beta 1? Because of stimulation of beta 1, what will happen? Increase in heart rate and increase in force of contraction. Because of increase in heart rate and increase in force of contraction, what will more? Cardiac output will be more. Because of cardiac output, if the cardiac output is more, the amount of blood which is present in the vessel is increasing. Because of that, blood pressure is increasing. Very good. You understood this concept? Now it is also acting on beta 2. If any drug which stimulates beta 2, what will happen? If any drug which stimulates beta 2, what will happen? Because of the beta 2 stimulation, it causes vasodilation. Because of vasodilation, what will happen to blood pressure? So what will be the net effect? What will be the net effect if isoprenaline is given? Isoprenaline is causes increase in heart rate also and decreasing in heart rate also. You understood this or not? Now let us see what will be the effect. Okay. See here, you can see the table. Okay. See here, we are given norepinephrine. Then if we are giving epinephrine, can you see the graph? And cursor is moving, and then isoprenaline. Okay. We know what is the norepinephrine action. It is predominantly alpha. Okay. So what will be the effect? It will cause reduction in the pulse rate. Why there is a reduction in pulse rate? Because through the reflex mechanism, cardiovascular reflex is there. Because heart rate has, because of the increase in the blood pressure, it will cause decrease in the pulse rate. Okay. So pulse rate has reduced. What has happened to blood pressure? Both systolic and diastolic has increased. Okay. It has caused increase in the systolic as well as diastolic, and thus it has caused increase in the peripheral resistance, which is a measure of blood pressure. Okay. So the peripheral resistance has increased. Now we are giving epinephrine. What is happening with epinephrine? Epinephrine is causing, see, very important thing is all are agonist, all are acting on adrenergic system. Okay. All are acting on adrenergic system. Now let us see what will happen. Epinephrine is administered, it has increased the pulse rate. Okay. Then another thing what it is causing is, epinephrine is having almost similar action on beta 1, beta 2 and alpha also. So because of that, what is happening? Because of the alpha action and increase in beta action, that is, there is an increase in systolic pressure because force of contraction, heart rate increased. Okay. It has got alpha 1 also and beta also. So there is a compensation of it, because alpha 1 is causing constriction, beta 2 is causing relaxation. So not that big change you will able to find in diastolic. Now, if we compare with the isoprotenolol, because of systolic will be increasing because of what is there, beta 1 action is there, so there is increase in heart rate, increase in force of contraction. So isoprotenolol has got increase in pulse rate because it is direct action. Norepinephrine has got indirect action, pulse rate reduction. Okay. Now this is what causing increase in this. At the same time, it is causing decrease in the diastolic pressure, and it is much more decrease in diastolic pressure because it is not acting on alpha 1, so there is no vasoconstriction at all, but there is only vasodilation. So systolic blood pressure is increasing because heart rate, force of contraction is increasing, their pulse rate is increasing, but at the same time it has caused vasodilation, therefore diastolic blood pressure is decreasing. You understood this concept? You understood? So until and unless your basics are good, you will not understand, you will not able to understand the impact, because there are direct impact, indirect impact. Okay. So these figures are very important. You read again, you read any book, you read Rangandale, you read Goodman and Gilman, but try to read the good books only, because they will explain you, they will tell you very clearly what are the effects. Okay. Now if you read it, then you will face the difficulties because it is quite vast. You should enjoy reading, because if you apply, then definitely it will be making you very very interesting in read. And if you take interest, if you try to relate it in that sense, definitely you will like pharmacology like anything. You will enjoy and it will be interesting one. So try to make interesting. Don't just try to give answers without any basis. It will rather confuse you. So go through this, see various effects. Okay. Very good tables are given. Few more things I'll be telling you. Read these books, go through this table well and see the basics behind it. Okay. So I hope the things are clear. Try to understand. Until and unless you understand, uh, you will not able to apply it for therapeutics. Okay. So please read it well, go through it in nice way. You make this in a systematic way. What are the actions of alpha, what are the action of beta, then which receptors are present in which tissue. Okay. And wherever they are present, suppose both are present like alpha 1 alpha 2, then what will be the important impact. Okay. This all thing if you read, then next class will be comparatively very interesting for you. Okay. We shall see some of the reversals, some of the impacts which are there. They are very important, so it will help you. Otherwise, you will easily understand all the pharmacology once you understand what are the roles of alpha 1 alpha 2 beta 1 beta 2, and what are the drugs which act on alpha 1 alpha 2 beta 1 beta 2. Then next step is going for more complex, what will be the impact, reflex impact of it. Okay. So that's we shall be studying what will be the reflex impact. So we have tried to understand what is reflex impact of it. And that is that is not indirect action of the drug, it is a reflex impact. Indirect is a different thing. Indirect means inhibition of mao, inhibition of comt, or inhibition of uptake. These are the indirect mechanism of action. In indirect mechanism of action, what is happening is the amount of neurotransmitter is increasing. So it is not direct agonist we are adding, we are indirectly increasing the concentration of this neurotransmitter or this adrenergic agent. So therefore we call it as a indirect. But here it is a reflex mechanism, which is a different one. So I hope you got the difference between this, and please go through it. I'm deliberately, I told you, I have taken it these small classes so that you can able to study it, and simultaneously, if same day you will read it, then definitely it will help you more. So go through it, go through the basics, and then tomorrow we shall have a few more things about this. So I hope you understood this. Okay. So apply it and just go through it, and you can put the difficulties wherever you are finding. By next Monday, we shall be solving difficulties. Thereafter, I will not take any difficulties about this. So next 2 3 days up to Sunday, you can read it well. What's your topic we are covering? So cholinergic, adrenergic, we shall take difficulties. Okay. Put these on our WhatsApp group. So take care. Have a safe time.